most common, especially in our setup, even worldwide, is now the diabetes and hypertension.
So if I have these diseases like diabetes and hypertension,
Yes.
it also puts me at risk of having kidney failure.
Yes, so those are the risk factors. So some of the common risk factors is diabetes, hypertension, and then things like being overweight, also like that's obesity, puts you at risk factor for developing kidney disease. Even alcohol as well is a risk factor. And sedentary lifestyle and smoking, all those are risk factors for kidney diseases. Yes, and that's why, like, let's say when we now talk about how do we manage. Now let's say for diabetics, we have to ensure that
kukosa kunywa maji, not hydrating enough, can that cause kidney failure?
yes, but you see, the body has a regulatory mechanism. If you start going towards dehydration, you see you have a thirst center that stimulates you to drink. So it's highly unlikely that you become dehydrated just because. Okay, but the only people maybe who are at risk factor of being dehydrated are the elderly, because you see their thirst mechanism is impaired, so they might not go and drink adequately, or those who've been admitted to hospital, so they're not able to drink as much. Yes, but normally for normal people, so I think the common thing that people usually say, okay, it's like a day to take 8 glasses of water, so that's around 2 liters. So yes, it's ideal, but you see not everyone is able to take 2 liters, so it's a variation. There are those who take less, but they're still okay. I think the end goal is just to ensure that you drink enough so that your urine is more clearer and just a bit some tinge of yellow, but not very concentrated.
So is kidney failure something that runs, is it genetic?
No, so for kidney failure, what we know is the risk factors that predisposes you to
Treating the disease.
Yes. So what are the risk factors? We've talked about diabetes. We talked about hypertension. So now we'll talk about genetics. Genetics we'll talk about now. Things that have been associated, like those conditions like autosomal dominant polycystic kidney disease. Those are associated with chronic kidney disease in the future. Yes. You really can't tell fast. When you come here in the hospital at first, it's very difficult for me to say this is acute or this is chronic, because you see, the only difference is the timeline. You have to reach more than 3 months for it to become chronic. So now, let's go back. How do you identify, let's say, once you just come to the hospital, how do we identify that you have a chronic, you have a kidney disease? So we'll start with, one, I get your symptoms. And if your symptoms are suggestive, like the symptoms I've told you. Now, the test that we'll do. So there are 3 main tests that we usually do. So we usually do something called urea and electrolyte test. So, creatinine is a product of metabolism. So it's a waste product, and it's usually filtered by the kidneys. Okay. And if your kidneys are healthy, you can measure your levels of creatinine. If your kidneys remains up for a week, inamaanisha the filtration is affected, so it turns out to accumulate, and that's how I'm able to tell that the kidneys are getting weak. So what are the tests that we should do? So that urea and electrolyte test, and most of the time we do a urinalysis, so that's a urine test. So with a urine test, I can guess features suggestive that the kidney is hurting. So presence of proteins, that is, you see proteins are heavy components of blood that are not filtered by the kidneys. But if I find proteins in your urine, it means there's a defect in the filtering system. So it means that it's leaking. So that's a sign the kidneys that are not working well. And then another test we should do is ultrasound, just to look at the structure. Like structure, you'll see that the kidney's size okay, they have any issue. Then once we do that, then based on the results, that's when I say now your kidneys are hurting. But then I really can't tell whether it's acute or chronic. Let's say you did a test like 5 months ago in the hospital that shows that your kidneys was weak at that point, and I do it now and it's still weak. So that's what I can say. At this point, you have chronic kidney disease. Okay. But then if you just come, let's say your kidney functions are good and we can go. And now I do, and I see it is elevated. So that one is an acute kidney injury. And then in an acute kidney injury, the only way I treat you is just to identify what has caused this kidney to be weak. So one, if making your kidneys weak. So things like those NSAIDs, which are painkillers, so many control that. Okay. Yes, and then now I have to check you regularly to ensure that it doesn't progress to CKD. Dialysis is just as long as we have our vascular access, we can clean the blood. Okay. So as long as you have you are able to have an access. So in most cases, from our end, we do catheters. So you can bear, there's one that can be fixed in the neck, and the groin, and then the other option is we can fashion something called a fistula. So a fistula is like a connection between an artery and a vein on the here on the cubital aspect of the hand. So what usually happens is now you connect an artery and a vein, and then it becomes bigger. So you develop, like, with that connection, you develop a very big vessel that now it's easier to dialyze from, because you can just fix needles here and here and dialyze from that. The advantage of this is you don't have any external, you don't have any foreign material in your body. You see, like a catheter is something foreign. And the biggest challenge with anything foreign in your body can become a conduit where bacteria stays, and then you get an infection. So this is usually easier because it means you don't need to carry anything with you. Okay? Yes. I think there are so many myths around it. So one is that as long as you have kidney disease, it's equatable to death. You see? Nowadays, with the advancement in medical care, dialysis is easily accessible anywhere. So once you're diagnosed with a kidney disease, it's very easy as well. Just get yourself a good nephrologist, ensure you adhere to your appointments, and you really have a very good quality of life. I've seen patients even with kidney failure who've been on dialysis for more than 26 years. They're able to do their normal activities, they drive.
But someone can stay on dialysis for years.
So dialysis is something that it's like your external kidney. So it means you live your normal life, but you have to go for dialysis like 2 to 3 times a week. Okay? Yes. So as long as you're dialyzing, you're able to put your health at a good state. Yes. So the people who dialyze for 10, 20 years, it requires discipline, and over time, most of them, as long as you have good dialysis centers, they're able to